Good morning, everyone, and welcome to the IWH Speaker Series for June 14th. This is our last speaker series of this session. After today's speaker series, we'll be taking a break, rejoining you back in September. Today, it's my pleasure to introduce Avi Biswas, who's an Associate Scientist at the Institute for Work and Health and an Assistant Professor in the Dalla Lana School of Public Health at the University of Toronto. Today, Avi will be reporting for us on some recently published work looking at optimal daily movement patterns for heart health using accelerometer data from the Canadian Health Measures Survey. I'll hand it over to Avi in just a second. Just a reminder to those of you who are potentially joining us for the first time, or for those of you who haven't joined us for a while, if you would like to ask a question of Avi during the presentation, please put it into the chat box, and then I will be asking Avi all the questions at the end of the presentation. So with that, I will hand it over to Avi. Just a reminder that there are a couple of polls in today's presentation, so stay tuned, and please, we'd appreciate it if you could participate in the polls as Avi puts them up on the screen. With that, I'll hand it over to you, Avi, and I'll see you during and then at the end of the presentation.
Great, thank you very much, Peter. I'm very happy to be here today to present findings from a study we had published very recently to examine the distinct physical activity profiles of workers and which of these are associated with optimal heart health. And I just want to warn you that I do have a bit of a cold, so if I do sound like Barry White, that's not unfortunately how I sound like in real life. So just bear with me, please. Thanks. So just going to go to the next slide. I just want to acknowledge our team. And so along with myself, my co-principal investigator, Dr. Cam Mustard, Cynthia Chen, our biostatistician and analytical wizard, and the person who made the analytical portion of this work possible, Dr. Peter Smith and Dr. Stephanie Prince-Ware from the Public Health Agency of Canada. And this work was funded by a project grant from the Canadian Institutes for Health Research. So I'm hopeful that we'll have a good discussion at the end of the presentation, which will give me a chance to answer your questions in detail. Now, I won't be able to cover the finer details of our work, and so I invite you to access the full paper, which was released, as I said, recently in the Journal of the American Heart Association. It's open access, which means you don't need institutional approval or any institutional writing. You just go on the website, access it, and you should be able to see the PDF. And if the scientific jargon is a little off-putting for you, I believe there will be on the IWH website a lay-friendly summary of the main findings and how we got there. And you can always join the regular newsletter to get more information as well from this study and other studies going on at the Institute. So in case you can't stay for the whole talk, here's the premise and key findings. And so we did this study because we wanted to identify the movement patterns of Canadian workers over a whole day. Now, what are they actually doing? And do any of these present strategies for promoting the heart health benefits of physical activity? And so we found 6 distinct physical activity patterns, movements from a population representative sample of workers, and what they did in an average week. And so when we examined their associations with future heart disease risk, workers with more moderate or high levels of physical activity during the whole day, whole waking day, or during evenings when we think our recreational hours, were at lower heart disease risk compared to the most inactive of workers. However, while our findings align with guidance that more movement throughout the day is good, we found that where we are active might matter. And so notably, high daytime activity, which is likely during the workday for many, was not statistically different to the least active workers in terms of their heart disease risk reduction. And so the implications of this work is that workers getting their physical activity outside of work might be benefiting their heart more than those solely getting their physical activity during work. Let's discuss more. And so there's this sizable and very compelling evidence base, and I've said this in other talks as well if you've heard me before, in that physical activity is just such an effective medicine for chronic disease prevention. It leads to a whole host of heart health benefits, physical benefits, helps you feel better, it improves your mental health. But unfortunately, you have to take the medicine. You have to follow up and meet the guidelines of at least 150 minutes of moderate intensity physical activity. Unfortunately, the global estimates show that about 25 to 30% of adults are not active enough, with similar numbers in Canada. And so, this physical inactivity contributes to unhealthy weight gain and obesity, high cholesterol, elevated blood pressure and blood glucose levels, and all of these are just a perfect storm which heighten your risk of developing cardiometabolic diseases, which, type 2 diabetes, heart disease, and so forth. And so the latest guidelines from the World Health Organization, so these were resupplied and reevaluated last year, is that adults should accumulate over the course of a week. And so it doesn't have to be in one time point, but just accumulate it, a weekly average of 150 minutes to 300 minutes, what we call a moderate intensity physical activity. So activities that starts to get you to sweat more, and then or a combination with 75 or more minutes of vigorous intensity physical activity. So now you're starting to sweat more profusely, find it very hard to sing or talk during your exercise. And so this is the guidance. And then the Canadian guidance, and this is represented by the image on the top right, takes a more holistic 24-hour approach where you need to be thinking about just moving more throughout the day, not sitting as much, and replacing that sitting with activity. And so that doesn't have to be moderate or vigorous, but it could also be lighter things like doing household chores, just going for short walks, standing up and sitting down, so forth. And also thinking about the quality of your overall sleep. So then, to meet the physical activity guidelines, if you think about just workers, well, the working population has to find time to accumulate physical activity either before, after, or outside the work hours. And so if you think about what that looks like for a worker, if you have kids, you have to get them ready for school or daycare, you have to get yourself ready for work, and then you have to go to work, be it by car, if you're able to actively commute, if your work is at a accessible location, then you can drive and bike and walk. And then at work, you have to have the conditions around you to be able to, maybe if you have flex time, to be able to take time to exercise, go for a nice walk. But if you don't, you continue sitting at your desk or move somewhere else to have your lunch. And then, you plan to go home. And then if you're exhausted, don't have as much motivation, then you could just be sitting around, not doing a lot of activity outside of work as well. And so our working lives really shape our attitudes, energy, fatigue, and time availability to be active. And conversely, some of us aren't able to do much activity outside of work. And so even though the best, and so we do, if our environment at work isn't really doing a lot to help us be active, our best bet is to be active outside of work, but sometimes we face those barriers outside of work as well. And so all this to say, meeting the physical activity guidelines and its lofty goals might not be easy for many of us, or even achievable if we're working. And so this brings me to my first poll. Hopefully we'll have a poll available to you to see. I can't see it myself. Which of these make it hard for you to be physically active? I just want you to kind of think about it. Even if you're active in the day, just think about what are some of the challenges when you can't be active, and check all that apply to you. Maybe we'll give ourselves 15 to 20 seconds.
Please go ahead, everyone in the audience, and tick, select all that apply. Okay, the poll has been closed, Avi, and I will read you the results. 46% of our participants said the workplace, the nature of their job. 60% said, I don't have much time or energy after work. 31% said, I'm not motivated right now. And 15% have said other.
Okay, so that's great. So actually that helps me a lot, because it tells me that I think I'm speaking to, I guess what I'm sharing is resonating with a lot of you, in that it's this dynamic between our working lives and our outside work lives that are really, this conflict that we're having to be able to be active and meet the guidelines and get all these benefits, for at least a sizable proportion of you. So that's good in a way. And so the current physical activity guidelines, which I shared earlier, while kind of they don't really exactly say it, but they do, you know, by saying accumulate physical activity through the week, you are saying we're promoting physical activity in different settings. And so where we work, play, live, commute, but they don't provide specific guidance as to what we should be doing in certain settings. And so I focus on the workplace. And if you heard my earlier plenary summarizing the paradoxical nature of occupational physical activity, you'll remember that some physically strenuous work can strain your heart. And so, you know, you can be, it's really in the workplace where you're doing a lot of this heavy, physically demanding, strenuous work. And that can sometimes be classified as, you might classify that as physical activity. And so you're doing a lot of lifting, pushing, pulling, you know, you're in construction or even in healthcare. You don't have a lot of recovery or rest. And so you're putting a lot of demand on your heart. And so I gave that analogy in my last talk. That can be like shoveling snow. And if you haven't had a lot of time to prepare and warm up, you're putting a lot more strain on your heart and increasing your risk for heart disease. So that being said, you know, with all the different ways that workers move, and even when they don't move, and so when they're sedentary, and there's a lot of research around the risks that come from being sedentary on your heart, what is the right approach for promoting the health benefits of physical activity in workers? So we know very little about this. And then also, what are they doing outside of work as well? And so when we try to figure out what they're doing, we are, you know, when we're thinking about populations of people, especially around workers, we tend to base our evidence on what people tell us in surveys. As we call it self-reported physical activity. And so this can be biased because when you're asking people, people tend to have this I guess exaggerated or over-report of what they actually do, because you don't consciously think about all the things you're doing in your day. And so because of that, we don't really have a sense of the precision of what they're telling us to what they're actually doing. And so given the ways in that people are active and not always in healthy ways and ways in their control, and recognizing all the different things that they're doing at work and outside of work, we need to understand, you know, what are they doing, but also are there alternative strategies that recognize the ways that they're, you know, working that can also be health promoting and heart health promoting. And so that's really the essence of what informed this work and inspired us to do this research, really recognizing the variability of movement of workers. And so the objectives of this study were, one, to describe the distinct physical activity patterns of workers. So what are they actually doing? And two, identify if any of these patterns are associated with future risk of heart disease over a 10-year period. And so we had the opportunity to examine a really interesting data set in that it's offered by Statistics Canada. But instead of a lot of Statistics Canada surveys where you just collect, you know, you just have a survey filled out by participant, we had the survey, but we also had more precise you know, clinical and activity data collected as well from people. And so it's called the Canadian Health Measures Survey, and we had data from 5 cross-sections of the population. This is representative of the Canadian population from 2007 to 2017, so 10 years of data. And then so we had the survey, it asked a battery of questions around lifestyle, socio-demographics, but then we had people where by going to a mobile testing center, what we call an accelerometer, an activity monitoring tracking device, almost like a Fitbit, an Apple Watch, and you wear it on your waist, and it essentially calculates through signals of your movement. So beyond just taking steps, it measures the intensity of your movement in different directions. And so they wore this device for hopefully 7 days. So they were told to wear it for 7 days. Throughout the day, their waking day, they only had to take it off when they were sleeping. So they also had to wear it when they were bathing or sleeping. And then it also collected clinical data at their testing center through their urine sample, blood samples. And so we had access to information on blood pressure, heart health measures, blood sugar, cholesterol, and so forth, and waist circumference. And so just an overview of our data processing steps. Just to be able to tell what people are doing at work and outside of work, we restricted our sample to a working population of people over the age of 18 and over. And so this gave us a sample of about 10,582 people. And then we, working with, and this is just a depiction of the type of signals you get from these devices. we were trying to classify what people are doing in terms of movements, whether they were in sedentary movements, light, moderate, or vigorous intensity movements. And so with this, we had access to information per minute. We averaged this for 10 minutes and then 10 minutes over every hour, so that's 6 time points, and then every hour for 24 hours, so it's 24 time points, and then 7 days. So you can see just how many data points we had to work with. And then, as I said before, we also had information about their clinical health, so assessed by a clinician, getting information about their heart health as well as their anthropometrics. Okay. And so then we did something a bit more novel to a lot of other physical activity studies. And so, our challenge was to see, can we actually classify people into patterns of physical activity? And so, as I said before, we had a lot of information to work with. So each person in our sample, and so we ended up with about 8,909 people that met our criteria and had usable accelerometer data to work with. And we had all these data points because we had movement information for every 10 minutes, as I said, for an hour, for a day, then for a week. All this information, we had this hunch that we could at least sort people into similar patterns. So there'd be people who would just be similar to you based on what you're doing at home and at work. And so we sought to identify these patterns and just classify this through this approach called hierarchical cluster analysis. And so essentially through this approach, we statistically grouped or created clusters of people with movement patterns that are most similar with each other. And this was the group that we were trying to test for future heart disease risks. We grouped them into these clusters. And then for our outcome, we wanted to look at their predicted risk for a 10-year first heart disease event. So we defined that as a fatal or non-fatal heart attack or coronary heart disease or stroke over a 10-year period among people free from heart disease at the time of study participation. And so to do this, it's essentially a calculation, and it's recommended by the American College of Cardiology and the American Heart Association, and it's based on your age, sex, race, clinical measures, whether you're taking hypertensives, and when you're estimating it, it's really guidance for clinicians to recommend statin use. And so a high risk corresponds to the upper risk threshold for prescribing low to moderate dose statins to reduce heart disease risk. And so you can actually access this estimator through the American Heart Association and the American College of Cardiology, or Google search it, and you can just put in your information about yourself, your demographics, lab data on your cholesterol, blood pressure, and then whether you have pre-existing diabetes, if you're a smoker, and other kinds of personal information, personal history. And then you can see your risk. So we had this information for each person, which calculated, and we were able to kind of try to find the association with these activity patterns and their risk. And then we then statistically controlled for the following variables. These factors could distort our ability to analyze the association between activity patterns and future heart disease risk. And so these were, in terms of measurement, how long people wore their accelerometer device, when they wore it, so seasonality, so if they wore it during the warm weather months, which might impact their movements and the responses they give on the survey, if they did in the summer or the winter months, and then their socio-demographic and lifestyle factors. So one a factor of interest was cohabitating with dependent children, which gives us a sense of responsibilities outside of work. And then work factors too. So how many hours they worked in a week, whether they were in full-time work, the amount of stress they reported feeling at work, if their work was physically demanding and involved a lot of high lifting, heavy lifting, and if it was sedentary mostly, or dynamic, if it involved a lot of moving between sitting to more walking and moving around. Certain types of jobs do involve this. And so what did we find? So our study sample, as I said, 8,909 workers gave us data that we could actually work with. And so we had to remove erroneous data, of accelerometer data that just did not give us representative data for the week. So we had to remove anyone who didn't have at least 4 days of data for 10 hours a day. And then so with data that we had to work with, we had a similar proportion of men and women, generally of lower middle age on average, more educated, 40% had young children living at home, 82% were in full-time work, working 40 hours a week on average. Many perceived having a stressful job, and many were overweight and obese, and overwhelming proportion did not have pre-existing diabetes. So then the crux. So what are the patterns that we discovered? And so I'm just going to go in order of the size of the sample. And so we had 8,909 people in our sample, and the largest sample were our moderate activity group. And so these were 3,219 workers. I'm just going to spend a little time to orientate you to this figure. And so on the top right is this clock that we have in our paper, and it's a 24-hour clock. And so we just try to kind of the shaded part of this clock is what we thought would denote kind of nighttime hours, usually like when you're not in daytime work. And then the white part is the daytime hours. And then the little pink parts are essentially little tiny bar charts and of intensities of movement throughout a 24-hour day. And so you see the 1,000. So in the inner circles around 1,000, that's kind of light intensity activity. And then 2,000 is moderate, and then over 2,000 is more vigorous intensity physical activity. And so I've just tried to simplify this into this picture you see kind of emanating from this circle. And I thought that this kind of, based on what's going on in the daily workday, say if we take this as a daytime job, say that you might think that this reflects a sales associate or other jobs as well. And so this is somebody who's generally quite sedentary, we found, leading up to their, I guess, a start of a daytime job. So around 8 a.m., they start to have more light intensity activity. And then kind of on a typical working hour day in a daytime job, you see more moderate intensity activity. So I thought of a sales associate because they're generally moving around more on the job, always having to kind of attend to customers, standing. And then as the day kind of ends, you're kind of doing less movements. Maybe you're thinking about going home, you're driving home, and then you're at home, you're not really doing a lot. And so you're quite sedentary in all the movements that are outside of the daytime hours. And so kind of following along with that, my understanding of this figure, we have our second group, which is our lowest activity group. So these are the people you would assume would get the least benefit, heart health benefits from activity. So lowest activity, we call this a sedentary person, because they're not only sedentary and they're outside of work hours, so between midnight, 8 a.m., 8 p.m., or even from 5 p.m. To night hours, but they're quite sedentary at work as well. So they could be, in a desk job, doing a lot of sitting, and don't have a lot of opportunities to do a lot of transitions from sitting to other activities. And so if they are doing other activities, they're generally lighter, so maybe going to the water cooler, going to the washroom, going to meetings. And then we have our fluctuating moderate activity group. So this could be our early childhood educator, even healthcare staff, nurses do a lot of moderate activity as well, so standing, moving around. And so they're doing a lot of this during daytime hours, and switching between light to moderate throughout that course of that time, and then maybe doing more at home, and then as you approach 8 p.m., kind of ending the day, not doing much movement. And then pattern 4 is our high daytime activity. So we're seeing a lot of activity in the daytime of vigorous intensity. And so, not much going on in the darker points of their circle. But then as you kind of go towards past 8 a.m., very high vigorous intensity activity. And so we're thinking that this could be, a construction worker, somebody working with, doing a lot of like lifting, pushing, pulling, maybe even in nursing or in healthcare, but just generally just a lot of vigorous intensity movement in the daytime, and then just kind of just drops in the nighttime hours, and then it goes to quite sedentary as closer to midnight and early hours too. Pattern 5 is our moderate evening activity. So kind of you're seeing a lot of the moderate counts going on, starting from like, I guess, just past midday, around 3-4. So they're doing some lighter activities in the daytime hours, but a lot of their movements are going on in kind of moving towards night, and it's consistent even through through midnight and early morning, and then early morning is just more sedentary. So we're thinking this could be even, things come alive from midday to nighttime. So this could be our night shift workers. And then as they kind of clock out, they're quite sedentary. And then our last pattern is our smallest group, 750 workers, the people with the highest activity. And so these are people who accumulated the most activity throughout the day, and they're kind of fluctuating from light, moderate, vigorous throughout the day. Maybe this is our most active person who's very, already has a very active, healthy lifestyle, thinking about what they're doing, and maybe they invested in a treadmill desk or have opportunities to be to exercise at work. And then they are also thinking about what they do outside of work and have opportunities to do so as well. And so this is our most active group. And so my second question is, where do you fit in? Which activity pattern fits closest to you on your typical activity timeline on an average day? So
okay, so the poll is up. If people want to take some time to give your responses, I'll read you out the results when we close the poll. We'll give 5 more seconds, but we just closed the poll. So, Avi, just to read you the responses, 24% of our respondents put themselves in the lowest activity group. 2% said they had high daytime activity. 35% said a fluctuating moderate activity or moderate activity pattern. 30% said moderate evening activity, and 9% were in the highest activity group.
Oh, that's really interesting. I feel like it does somehow reflect our classifications in a way. And also the lowest activity group, it also kind of reflects, we see about, I said 25 to 30% of the population are not active enough. It's interesting, maybe in this very small microcosm of our attendees, it's quite reflective of the Canadian population as a whole. So thank you. I'm also very impressed that you all remembered what I just shared and all those graphs. So thank you for that as well. So what did we find in terms of 10-year heart disease risk? And so just wanted to orientate you. This is a forest plot. And so a forest plot, I just want to orientate you to the main parts of this graph that you should be thinking about. And so we see the 1.0 on the graph on the left. Any number that's kind of below that 1.0 means you're at lower risk. It's really the relative to our kind of our reference category, which is the lowest activity group on the left, which is all the other activities we've compared to the lowest activity group. And anything, if the risk is going down, it means you're at lower risk for 10-year heart disease. And anything that's going up above 1.0, it's at higher risk. But you want to make sure we call confidence intervals, which is really the range of outcomes that we think are plausible for our risk. If they cross the 1.0 barrier, it means that we're not confident enough in our statistical estimates that these are actually estimate of that's statistically plausible for this estimate to actually occur. So start with our moderate activity group, and you see here that in our association with 10-year heart disease risk, there is a lower risk for heart disease, and this is about 14% lower risk compared to the lowest activity group. So you can see it's a lower risk, and which is great, and kind of jives with this idea that every movement counts. So you're doing more moderate intensity activity, you're getting some benefit that comes with movement. And then you're getting more activity with the fluctuating moderate activity. You're getting, something I didn't share earlier is that there's more movements accumulated in this group, and so you're getting this larger risk reduction, about 26%, 27%, that comes with fluctuating moderate activity in this group. And then our third group, our high daytime activity, though there's a 7% risk reduction, this group, you can see when this bar, this vertical bar, it's crossing the 1.0 mark, which means we're not confident that this is actually the case. It's not statistically significant in this estimate that we're sure that there's actually a risk reduction going on. It might be that this is just there's no difference in risk compared to that lowest activity group because it's crossing the 1.0 threshold. And then the moderate evening activity group, where we're seeing a lot of activity, maybe night shift workers, a lot of activity going on after midday to nighttime, a big risk reduction. There were a lot of variability in what they could possibly be doing, but a big risk reduction of about 42%. And then our highest, or among similar highest risk reduction is the highest activity group. This is also, reflecting our understanding of the benefits that come from meeting the guidelines, exceeding the guidelines, doing a lot of more vigorous intensity physical activity to get the benefits that come from exercise on your heart. So I will get to kind of the implications and controversies of those findings, but I just wanted to give you a sense of the characteristics of this group. And so we had access, though we kind of based our main findings on accelerometer data, we did have access on some of the cycles of the health measures survey of what people reported doing. And so we wanted to be able to then just kind of cross-analyze and validate what we were seeing with the accelerometer data with what people are actually reporting to us as having been doing. And so just wanted to highlight in bold the more common the proportions of kind of typifying what is commonly reported in each of these patterns. And so in a moderate consistent activity group, you're getting people who are also doing 31% are doing more physically demanding jobs, as well as those people in high daytime activity and moderate evening activity. So some of them are doing physically demanding jobs, but then the difference sometimes comes in with what they're doing outside of work as well. And so you see that the moderate evening activity are doing a lot of recreational physical activity, about 124 minutes a week. Then the highest activity are doing the most, 180. Some people are doing active transportation a lot in the week, so biking, walking to work. So that's about 119 minutes in the high daytime activity group. And then other physical activities. So these could be, related to work. This could be related to household chores, things you don't associate with exercise. So 190 minutes of the other stuff, so we think is very much related to high daytime activity group related to work, and then 443 minutes in the moderate evening activity, so maybe they're doing a lot of chores at home. And so when we get to the findings and reflections on the findings, I just want to give you a sense of some of the limitations with the study that should be considered. And so first, even if they're more precise estimates of physical activity over a continuous day and week and can provide us more movement data for a large number of people, accelerometer devices, because they're worn on the hip, may not capture things that people do with their arms or when they bend down, so like lifting, pushing, pulling, things associated with physically demanding jobs. So we're not likely to capture that information very well, may not capture enough of it. Second, we are working with a cross-section of people at one time point. We have multiple cross-sections of people, and so not the same people followed up over time, which means we can't really assess the relationship between activity patterns and heart disease risks that are actually causally linked. We only look at associations. Lastly, most of the 5 cycles did not collect information about when people were at work and outside of work, and so what we had to do was we worked around this by collecting within some of the survey cycles that collected this information about when, I guess, what proportion of people were working in regular daytime hours, a 9 to 5 job or 8 to 5 job. And so we found that this was about 80% of our sample in those select cycles of the CHMS, Canadian Health Measures Survey. And so it gave us enough confidence to feel that our inferences about what's going on during daytime hours are actually reflecting work hours for many of the people in our sample. So our discussion, and so to summarize, even if when there was a lot of activity during daytime work hours, it didn't seem to be associated with a reduction of future heart disease risk, as it was for those who are only or also active during recreational work hours. So why might this be? Well, we think it might be because of the way many workers who engage in higher intensity physical activity on a job, just the way they do that. And so it might not be because they're all owners of treadmill desks or of exercise programs in their offices. It's quite possible that these people are also experiencing physically demanding jobs, and the consequences of these work tasks is having negative consequences on their heart because of the high intensity of these jobs and a little opportunity for rest. And so just this dynamic of high intensity jobs, less activity outside of work, and maybe and being sedentary and the risks that come with that, it's just like the cumulative risks together may be having maybe causing that net lack of health benefits for heart health. There's also, we want to highlight that there's also potential benefits that come from moderate intensity physical activity, particularly that group with fluctuating levels of moderate activity. And so here's where I think there's a lot of potential implications for equity, and that it can be very hard for many people to meet the guidelines. And maybe these patterns are a more feasible target for many workers because we based our patterns based on what is actually going on among our sample of workers. And so it seems like there's a sizable proportion of people doing them, and leading to heart healthy benefits. Maybe this is a feasible target for people for physical activity interventions to focus on. And so implications of this work. Well, in 2018, Participaction released a report on the pulse of Canadians on their physical activity. So people's attitudes, beliefs, and opinions about physical activity. And they found that there was certainly a recognition by over 80% of respondents that physical inactivity was a serious health issue, and they were also aware that people needed to be more active. So it's not really for a lack of trying or want. But in the same year, the federal government released its Common Vision Plan, which recognized that everyone contributes to physical inactivity, and to encourage physical activity for all, interventional strategies should focus on the settings, cultural norms, and spaces and places that influence people. So I believe this work is a start in providing guidance to workers who may not have the structures and environments in place yet to meet the guidelines. Hopefully, if we just focus on what people are actually doing right now, it's that opportunity to kind of help more people realize the heart healthy benefits of physical activity. But hopefully then we can realize the goals set by the Common Vision Plan so that more people can have supports at work and at home to get all the benefits from physical activity as recommended by the guidelines. So that's all I have for you today. Thank you for listening. I'm looking forward to all of your questions. Thank you very much.
Great. Thank you very much, Avi, for the presentation. Just a reminder to people in the audience, if you do have a question for Avi, please put it in the questions box and I will read out the questions as I receive them. There are already a few questions in the box. Avi, just to start us off, you had mentioned this a little bit at the during the limitation sections around the types of activity that would and would not be captured by the accelerometer. So would things such as pushing or pulling, at the workplace, would those types of activities be captured by the accelerometer, or is it really only when you take a step?
Yeah, so the accelerometers are worn on your waist, and so it really captures really well when you move your hips. And so you're walking, you're jumping, you're running. It captures those movements really well. It captures even the transition from standing to sitting. But then when you're doing things with your arms, you may not be moving your waist very much, right? So say you're doing a lot of pulling. Something worn on your wrist as well would be great. And say you're doing a lot of you're bending down, so it captures your bending because you've moved your waist, but then you're pushing and using your arms. It doesn't capture the intensity of that movement using your arms. And so why didn't they do this? Well, this wasn't really how the survey was designed. It was designed to capture physical activity. And when it's worn on the waist, it's generally a very accurate measure of physical activity. There are studies going on that get participants, though it's smaller samples. They don't get large population representative samples yet, but they are getting people to wear body vests, getting people to wear a combination of devices on their wrists, on their waist, on their knees, on their ankles, and so just different interesting ways to capture whole body movements. But if you're trying to capture just physical activity in a population, the waist is really the way to go.
Okay. A few questions just around the relationship between the different activity patterns and heart disease risk. So both, if you could go into a little bit more detail on the sort of what mechanisms are at play, what are the causal mechanisms that link different types of activity patterns to heart disease risk, with also an interest in, is the relationship, does it differ for men and women? So does particular activity patterns, they differ for men and women, noting that some of the occupational activity paradox findings have been stronger among men than women.
Yeah, so in terms of the mechanisms, and I'm going to just, I feel like I'm not the best person. My doctorate is not in the medical field, but in terms of the mechanisms, I think a lot of it is to do with how activity impacts our metabolism. And so when you are active, the first link is our energy expenditure. And so when you're not, you burn more calories, and then as a result, the way your body processes and breaks down sugars and pumps blood throughout your vessels and essentially strengthens your heart. All of that is like more efficient, and you're strengthening your muscle, and your body is just essentially working better to kind of break things down and get things supplied to the other parts of your body. When you slow things down, you essentially slow down your metabolism. Your body, the way it kind of isn't, your body isn't as efficient in metabolizing things, and then you increase your risk for, you essentially blood glucose stays in your vessels more, and then your body is less efficient in breaking that down and creating insulin. And so essentially you increase your risk for type 2 diabetes, and type 2 diabetes is on that causal pathway to heart disease and the blocking of your vessels, narrowing down your vessels. And so all of this to say, like, just the way the blood is pumped around your body becomes less efficient, and there is that, I guess, all of this is a mechanism towards increasing your risk for cardiopulmonary diseases like heart attack. In terms of the second question, differences between men and women, and so we could not, with the way this our outcome was structured, we could not assess men and women because our outcome itself took into consideration men and women. In that to respond to the equation, you had to put down your sex, and then you put down all this other information. And so sex was a part of our outcome. And so that wasn't something we were looking at for this particular study. That's not to say that it's not something we're looking at. We are doing a study where we're looking at the differences in men and women for these activity patterns and different types of markers of cardiovascular risk, like your heart, your waist circumference, blood pressure, cholesterol, and so forth. And so with that, we are seeing some differences in men and women, and it's very plausible. I mean, if you think about just kind of the structures of first movement, there's definitely a research that shows that men and women accumulate physical activity differently. In general, men accumulate more recreational physical activity of a higher intensity than women. And maybe that's to do with kind of challenges to find discretionary time for women because of all the responsibilities they have outside of work. And then during work, because of the gendered labor force, men and women tend to do different types of jobs. Maybe men are more represented in construction and heavy physically demanding jobs, but that's not to say women aren't in physically demanding work as well in, say, healthcare. And then also the type of things they're doing on the job. And so all of these things can present differences in heart disease risk related to physical activity and inactivity. So stay tuned for the second study to come out, and be happy to share those findings with you.
Great. A question about whether there was an adjustment for people who might have activity limitations, given that sometimes particular types of job demands might be associated with work limitations, or like work injury or other types of activity limitations. Was there an adjustment for activity limitations that people might have in terms of the profiles?
Yeah, so good question. Not an adjustment per se. We did not include them in our sample. And so one of the selection criteria we had was that people had to be reporting that they could be mobile without any kind of difficulties in being mobile. And so the reason we did that and not adjusting is that we wanted to make our sample large enough for us to be able to do our analysis. If we had adjusted, we would probably have to control for it. But no, we just wanted to select people who, on an ordinary day, their health does not impact their ability to be active.
And so there's a related question, which is about if there was control for medications that people might be taking. Was that possible with the data source?
Yeah, so there wasn't a control, but the medication question, did people take hypertensives? That was a factor included in our calculation for our outcome. So the pooled cohort equations that informs that 10-year predicted risk for heart disease does include whether people were on any kind of hypertensives or not, but we did not control for it.
Okay, and other types of medications around glucose metabolism or any other types of medications, were they?
I believe there was a question around blood sugar lowering medication, but no other questions that we included.
Okay.
And that was also for our outcome, not controlled for.
So there's a few questions around sort of advice. I feel like noting that people want to be active and that's not the barrier, and then we need to take a settings approach. I feel like I've heard that for probably the last 30 years. Is there any practical advice that you think is worth giving at the moment around how activity could be structured within the workday or particular approaches? So, for example, in the question box, would engaging in a little bit of activity throughout the workday help people be more active outside of the workday because they might increase their energy levels? Or is there other things that you've seen, not in this study, but in general, that might be promising interventions?
Yeah, good question. And hopefully I can answer a lot of the other questions related to this. So I guess there are limitations in this study in that I have to be careful as to saying that these findings are going to lead to improvements and you have to follow what I say. But I think I can definitely take hunches from the prevailing evidence in this area. I think it's important, if you're thinking about activity in the workday, it matters the type of activity you're doing. And so, I think there's a lot of evidence talking about this paradox where physically demanding work with very little rest is not giving you those benefits that you might think are associated with physical activity. And so, excuse me, the one advice is, think about the activity you're doing at work. If that activity is health promoting, then that's good activity that's on par at health promoting, and that you're doing it purposely to get exercise. That's great, and do more of it and try to accumulate it throughout the day, and think about those guidelines of 150 minutes. But if you're doing higher levels where you're putting a body through a lot of strain, then that's not health promoting. And so either you try to give yourself some rest at the rest of the day, but then also think about you're not really getting those benefits from physical activity there. Maybe thinking about doing some moderate or light intensity physical activities in your recreational time, if you can, if you have the energy, even on the days maybe when you're not doing those physically demanding job tasks. And in general, there's a lot to say about if you can't do vigorous intensity physical activity, if you're not able to just break a sweat, if you don't have the time to do high intensity activity, there's a lot to say about just going for casual walks, going for lighter or moderate intensity activities, because every movement counts as per what the Canadian guidelines say. So think about just chalking off as much as you can do, as much as your day allows you to do, as much as you can make do with all the other things you have going on in your life. And so I think ultimately, this message is to the person. But I also want to say that if we do have people who represent employers, it is a partnership, and it's not just telling people to make this move on their own, but they need to be supported. And that a partnership, because we need to have supportive policies in the workplace that allows people to be able to move more and engage in healthy exercise and physical activity in the workplace, maybe through flex time, maybe through supportive environments. And that ultimately helps people chalk off activity before, during, and after work. Hope that helps.
And I just wanted to clarify, Avi, maybe it's a bit of a pet peeve of mine. When you say health promoting activity, you are talking about movement as opposed to simply standing at work a bit more.
Yes, and I invite you to find Peter's presentation on standing in his paper on occupational standing and its risks. And yes, occupational standing found by my colleague has been shown to be quite hazardous for health. and maybe it's about finding a balance. So if you are doing a lot of standing, and usually the workplaces where you do most of your standing, which you can't control, trying to find times to rest. And so health promoting is really trying to limit things that are to do with high standing or physically demanding work.
Okay, a question about one of the results, which is around the reduced risk among the moderate evening activity group. And if this group did contain people who were engaged in shift work, we know that shift work can be unhealthy in various ways for workers. Do you have any thoughts about why this group was at an increased risk in your paper?
Yeah, so I'll pull it up for you so you can see the moderate evening risk. And the question is, why were they at a reduced risk? And considering the stresses that come from working shift work, right? And that's a good question. We did control for work stress. So that means that we did not factor in the effects of work stress in our model. And so maybe if we had looked at the role of work stress, this estimate might have been different. And so it's very possible that shift workers it's widely acknowledged that shift workers experience a lot of other strains from the job. But it's possible. We were just trying to find, just cleanly the association between activity patterns and heart disease risk. But it's possible that these shift workers, their risk might actually be slightly different if you factor in all the other strains that come from doing that type of job.
Okay, we've got time for a few more questions. In terms of, you were commenting, Avi, that this was a cross-sectional survey. Are there opportunities? Is there currently data available in Canada or elsewhere that actually measures the same people's activities over time using accelerometer data, or is able to look at how an activity pattern today actually is associated with the risk of an actual disease occurring in the future? Are there other opportunities to expand this work?
I unfortunately, there might be. As I do not know of large population-based studies that are using, I guess, clinical grade accelerometers to measure movements over time of the same people over time. It's very possible. I mean, there's a lot of research going on using Apple Watches and Fitbits, and the challenge is making sure that this information from these devices are precise, because they are measuring movement through the wrist, but you're not calculating movement as much from your waist where you're doing a lot of movement. So it has challenges in terms of precision of movement data there. So I'm not aware, but of course there's always going to be new studies out there. I'm really hoping that I have access to this type of research in the future, but I'm just not aware right now. And in terms of the second part, which is, I guess, linkages with, I guess, is it more accurate measures of future risk, I think that would be great if we could link this to clinical data sets, like people's medical records and when they actually enter a hospital or get surgery for a heart event, so we can get actually a sense of whether these activity patterns lead to or do not lead to a heart event, rather than just having to predict it through calculations. But yeah, I can't give you an actual study or group right now, but I'm hopeful that there are. I just don't know of them right now.
Okay, we just have one final question, which was just around the work stress, around whether work stress was considered in terms of its implications around heart health with cortisol production. You were saying before, work stress, the estimates you've presented today have been adjusted for a measure of work stress. Is that correct?
Yes, it's a self-reported measure of work stress. So people were asked, how much stress do you feel on a regular working day? And they were just, they would report if it's like some or a lot, or sometimes, often. I don't remember all options, but this is just all self-reported, so it's not a clinical measure, but it was when we controlled for it.
Okay, great. Thank you. So thank you everyone for attending today. Thank you, Avi, for the presentation. Just a reminder, this is our last presentation of our current series. Our next speaker series presentation will take place on September the 20th. The registration for that seminar will be up over the summer with information on the speaker and the topic. If you would like to keep up to date with information from the Institute for Work and Health, please subscribe. You can subscribe to our newsletters, you can subscribe to the speaker series presentation. Sabrina has just put the link in the chat box. It is iwh.on.ca/subscribe. So thank you everyone for coming. I'd like to also give a special thank you to Sabrina, Sarah, and Christina, who do so much of the work behind the scenes to ensure that the speaker series sessions run smoothly. Thanks everyone for attending, and we'll enjoy your summer, and we'll see you in September. Thanks everyone. Bye-bye.